So we're about to start the afternoon of presentations. Our next speaker is Dr. Jayne Donegan. Jayne, are you there? I can see your icon.
Can you hear me?
I can hear you.
Oh, good. Well, you get to see me now in all my glory, I think.
I will get to see you. If you start your video, then we'll definitely see you. Chiara, do you mind spotlighting me
with my with my eye patch and 2 sets of glasses on because I have a corneal abrasion. I was hoping I might be able to take it off for an hour, but I don't think I'll be able to. And of course, it's on the better eye. So not being binocular, not having 2 eyes, I have to have my normal set of glasses plus an extra set. So
well, I've always said you were a trooper, Dr. Jayne Donegan, and now here we have the evidence. So I'm going to introduce you, and just as a sort of interesting little anecdote, coincidentally, Jayne Donegan was my GP. What was it, back in 1998, after I had my first child?
Certainly, well, it's certainly after 1995 and before 2001.
Yeah, and so we met at the beginning of my journey health, and how lucky was I that Dr. Jayne Donegan was my GP and could help me with all things homeopathic. So I'm just going to do a quick introduction, Jayne. So Jayne started, like Dr. Sarah Myhill and Dr. Sam White, classically trained GPs, and Jayne trained at St. Mary's, which is a pretty special teaching hospital. And I remember you telling me the story about how you became interested in homeopathy. I can't remember why you did the course, but I do remember that you had a patient who was who had Down syndrome, and she was coming up to menopause. And you said you took a very rough case history and prescribed her with some homeopathic remedies, didn't see or hear from her again, and thought, oh, well, that probably didn't work. And then you bumped into her and her mum in the street, and you sort of asked, I just wondered how you were. And apparently all her symptoms had gone.
Yes.
So maybe that's a good chance to hand over to you, so that you can tell us more of these stories. So this is Dr. Jayne Donegan.
Good afternoon, everyone in the countries that it's afternoon. So yes, thank you for inviting me to speak at this conference, which is a very important one. And yes, I'm going to talk to you about basically how you manage fevers, because in my journey, I've found that this is the most important thing you need to be able to understand. And it's one of the things that is worst managed by conventional medicine. Although latterly, really since 2007, this has been with conventional medicine not following its own guidelines. There's a lot of talk about doctors acting like automatons and just following guidelines because they think they'll be protected if they do that. But in this particular case, the guidelines are very good regarding fever, the NICE guidelines, and people don't follow them, and no one complains about them. And there's a lot of conversation about interventions such as vaccination. And when you're not looking at COVID vaccinations, when you're looking at the ordinary ones, not necessarily the flu ones, but you have them in your first year, and then you have them when you're preschool, and then you have them when you're leaving school, not that many overall, but people have gallons and gallons of paracetamol and ibuprofen prescribed to them every single day, which causes measurable harm if anybody were actually looking for it, but most of it just gets blamed on the disease. It's the disease that caused this to happen, and nothing to do with the medical treatment. So there you go. So I'm going to talk to you about fever. Now, one of the big differences between holistic doctors and regular doctors, I'm a regular doctor and a holistic doctor, though I did not renew my license to practice, and I'm just practicing now as a naturopath and homeopath. One of the big differences is that, well, 2 things really, actually. One is the germ theory of disease, which is a attributed to Pasteur, the French chemist in the 19th century, who said basically that you meet a germ and either you had it before, so you've got antibodies, or you've had a vaccination, so you've got antibodies. Otherwise, you're going to get it. We know this is wrong because on a bus, basically, when someone has this year's flu, which we're told changes every year, that's why there's a new vaccine every year. Not everybody on that bus will get that flu, even though it's different. So we hear these things, even though our actual experience every day doesn't bear that out. So we know that's not true. And the other thing is that the symptoms are the problem. So the symptoms are the problem, so that's what you need to get rid of. When in fact, the body being quite marvelously created, if it weren't, we wouldn't have survived to the 20th century, never mind the 21st. The body's very clever. And the only thing over centuries and centuries that really kill bodies are not having the basic wherewithals of life. And the basic wherewithals of life are clean water, adequate food, ventilated housing, some fresh air and sunshine, and someone to love and look after you. That's what you need, even if you're like Romulus and Remus and the love and care comes from a female wolf, okay? That's what we all need. That's why those poor babies in those Romanian orphanages who were infected with HIV-infected blood, sorry, no, not those ones, the other ones, the ones in the nurseries where they just lay in the nurseries, the white nurseries with the white sheets and the white walls and the white clad nurses who never picked them up, they just fed them with sort of white topped bottles. They became delayed in their development irreversibly and never be able to become normal people, because children have to have love and affection. And the HIV thing was just another thing, which is another strange medical practice that we come across every now and again. So the body's very clever, and given what it needs, it's going to stay alive until it's allotted 3 school years and 10 or whatever extra you can get over that. We hope more. And so when it gets symptoms, it's telling you something, that there's a problem. Now, we don't have any problem with our cars. If you have a car, when the little red light goes on saying there's not enough oil, you don't say, oh, let's just unscrew the bulb because that little red light is a bit upsetting. You say, that little red light is telling me that I have to put oil in the car next time I go to the petrol station or when I get back home to my garage. But with symptoms, we're quite happy to have them blotted out. Now, if you're a holistic doctor, you know that the symptom, like the red light with the low oil, is not the problem. The problem is the low oil. So all you need to do is to put the oil in and then the light will go out and you won't have to worry about it anymore. And the same with the symptom. The symptom is our body's way of telling us that there's a problem and we just need to work with it. So the fever, when we get fevers, far from being a problem, it's actually really, really necessary. And I'm now going to share my screen. I'm going to share my, I think I'm going to anyway. Can I do this? I'm sharing my screen. Can I share my PowerPoint, Sally?
You can share. Just press share screen.
Oh, here we go.
At the bottom.
Yeah.
And then you should get the instructions top left.
There we go. And where is it? Oh, here we go. Right. Okay. So it's not perfectly shared. I have this very interesting thing with Zoom, which is it doesn't allow me to share my whole screen. So I have to have the little bits down the side. So this is an illustration of the boxes. And the boxes are what I was taught by a holistic practitioner many years ago. And they made so much sense to me. It's how I explain it to people because it's how I understand it myself. So basically, when you're born, you're an empty box. The philosophers call it a tabula rasa. Of course, you might not actually be an empty box because, for example, if your mother is in a refugee camp or you've had to flee your country or something like that, you being in your mother and while she's breastfeeding you, you are your mother for that amount of time. So there are some children who are born with some baggage, so to speak. But for many of us, we're lucky enough to be born as an empty box. And the process, even if you are born with baggage, is the same. And then over time, due to things like pollution, too much sugar, pesticides, estrogenic chemicals put on our food, being stuck inside too long, parents arguing, which is sort of fairly normal, this type of emotional pollution that we need to learn how to discharge. We build up what we loosely call toxins. Now, holistic people talk quite a lot about, well, depending on the holistic person, they talk quite a lot about toxins. And what are toxins? Well, we can't really measure them, which sounds nebulous at best. But there are many things that we can't measure in life. I mean, if you wake up one morning full of energy, you can't measure that compared to the next day when you wake up with none. And there are many things in life which are really important that we can't measure. And certainly for myself, the more I learn about different types of healing, different types of philosophy, and different types of religion, the more I learn that what we know is so minute compared to what we don't know. It behoves all to be a little bit humble about what we can't actually measure. However, while we can't necessarily measure it, like we can measure liver function tests or sodium or potassium or something like that, and it must be said, when you do measure those and you're out, you're really, really out. All these things are measured in a bell-shaped curve, and we have arbitrary cutout points of maybe 3% or 5% at one end and 95 or 97% at the other end. But basically, if you're supposed to be at the 10% end and you're actually at the 90% end, it's actually not normal for you. So we do love figures and we love things with decimal points. We think they're really marvelous, but they're not all they're cut out to be. But we can see ourselves, people who look healthy and are toxic. So for example, a healthy child will have smooth skin, clear eyes, shiny hair. They'll move normally, not too much, not too little, and they may have food rackets, but when they want to eat, what they will want to eat will generally be what we consider food. A toxic child, conversely, they often have sallow skin. They might have some rings under their eyes. They might move too much or just sit there doing too little. They might have dull eyes, limp hair. We know what a toxic child looks like. And in fact, we've been designed to know what people who are toxic look like, because really we're designed to go off and mate with the ones that look nice, which often goes with beauty, as it happens. So we know what toxic children look like, even if we can't stick a needle in their arm and find out what their level of toxins is. And in fact, that's much better, because it's much better to have something we can all see ourselves than have to go to some other person to do some intervention with. So you build up a certain amount of toxins, but all is not lost, because in a healthy person, and children do this best, and I revamped this lecture during the COVID situation because so many people were terrified they were going to die. And children do it best. We can do it also, but we're not quite so good at doing it once we're over the age of 6, that old. And there are other things we can do to help. But looking at the people who do it best, the children, but what we do is we get a raised temperature, which is totally crucial. Why? Because all the reactions in the body are controlled by enzymes, and enzymes work a bit better and more efficiently when the temperature is higher. So the body works better, the liver detoxifies more quickly, the kidney filters more efficiently, the white cells gobble up intruders and problems and get rid of waste a lot better. So you might say, well, if it's so great, then why don't we have it like this all the time? Well, that's because the body is very economic. If you had to have it at a higher temperature all the time, you'd have to eat more food, process it, break it up, break it down, whatever. And so the body has the normal temperature at what it needs to be at to do what it needs to do. And so you can be sure that when it actually goes into a situation where it's going to make more work for itself overall, that's because you really need to have it. Okay, so the temperature goes up. Usually the appetite goes down, because if you're going to clean yourself out, the last thing you want to do is stuff yourself up with more things that need to be broken down. And people tend to get worried about people who don't eat when they're not well. I'm talking about acute illness. Obviously, if you have some long chronic condition, you need to get some nutrition into you. In the acute sense, you don't have to worry about it. It's only fluids you need to worry about. So the appetite goes down. You do use about a third of the food you eat to digest it in terms of the whole metabolic process. So you're not actually losing quite as much as it seems. The other thing is that 80% of your immune system is what is called the MALT. That's the mucosal associated lymphoid tissue. That's 80% of your immune system. That's nothing to do with antibodies. That's just 80%. So that's the bit between your mouth and the other end. Okay. And so you can see that you wouldn't necessarily want to block it up with having to digest things. So that's the massive part of your immune system. So that's another reason for the appetite going down. A quick way of getting rid of things is throwing them up or throwing them down. That's diarrhea and vomiting. And the last way it might come out is a rash, which we often see, and we often still see children having rashes. They go to their doctors and they're told, oh, it's a non-specific viral rash. And we used to have many more of these at the appropriate times, but we've taken it into our heads that we need to stop this happening. But you can see that a rash that occurs along with an increased temperature, loss of appetite, and other symptoms is a way of expelling rubbish from your body. And at your peril, you don't allow these things to happen. And the last thing that might happen is mucus. Although mucus is sometimes not part of the acute picture, you might have mucus for days and weeks because the body being quite economic, if you've got a few things like a bit of snot, maybe a bit of a eczema or something, or you have a couple of warts, the body's not that fussed about it. You might be fussed about it, or your relatives might be fussed about it, but the body doesn't really bother about this because it's not interfering in any of the processes in any way. But when the body decides to have some kind of a clean out, for example, the chickenpox associated clean out or detox, at that point, when it's rousing itself to decide to increase the temperature and get the whole clean out process going, it will, if managed properly, get rid of the snot and a couple of the warts at the same time. Okay, so that's how it works. So when I'm doing a live, or people are sort of opening up their unmuting themselves to ask things or to answer things, I ask them, what is the problem with the temperature? Why does this get interfered with? Well, the big place it gets interfered with is people being told to reduce the temperature. They're told by health professionals, they're told by doctors, nurses, health visitors, all sorts of people. Some don't, but in the majority of times they do. I ask people, well, people say, well, the temperature is dangerous and you have to reduce it. And I say, where did you come across that information? And they mention health professionals. And then I ask them, and so what is the problem with having a high temperature? And people talk about, well, brain damage and febrile convulsions. So it's very interesting to note, and I've been giving this lecture for decades now, but over time, the guidelines have caught up with me and other holistic practitioners, even if the normal general practice doctors haven't seemed to have read them very much, where the guidelines in 2007 from NICE came out saying, do not routinely give antipyretics, which are fever lowering agents, to a child with a temperature who's otherwise well. So you might say, how can they be well if they've got a temperature? Well, they seem otherwise okay, they've just got a high temperature. They also said, crucially, do not give antipyretics for the purposes of stopping febrile convulsions, because they don't, which is massive. Okay, giving antipyretics, which we could call paracetamol and ibuprofen, do not stop febrile convulsions. And the literature, and certainly my experience, is that you don't get febrile convulsions because of the height of the temperature, but the speed with which it rises. And so you can have a temperature of maybe 40 degrees and the child is like a red pillar box, but it went up nice and slowly. On the other hand, you can have a child who's got a temperature of maybe 37.9, but it went up really fast and they convulsed. Okay, so that was interesting. Then in 2012, they came out and they said more. What they said was, they repeated what they said about they don't stop febrile convulsions. And then they said, not calling them antipyretics anymore, but paracetamol and ibuprofen by their names. They said, give paracetamol and ibuprofen for distress. Only so long as there is distress, don't give both agents together. Only consider giving the other one if the distress returns before the dose of the first one is due. So they're not saying 38, 39, 40, whatever. They're saying distress. Now, there are other ways of helping distress, but if people only gave paracetamol and ibuprofen for distress, there would be so much less given. There are people, you know, who give paracetamol, a teaspoon of paracetamol to their child before they go to bed at night because they've noticed it seemed to make them sleep more. Well, the paracetamol has to be broken down by the liver. And so if you imagine what you felt like, if you can remember, when you had a horrible hangover because your liver was feeling so ill with having to detox all that alcohol that you overindulged in, and how you just didn't want to be woken up. Well, you can imagine that could be one of the mechanisms why a child doesn't want to wake up after you've dosed it with paracetamol, because its poor liver isn't feeling very happy. So, as I've said before, the liver is one of the main detoxifiers in the body. When you take paracetamol and ibuprofen, they have to be broken down by the liver. So the liver that's trying to empty that box is now trying to detox the paracetamol. Another thing is, when you are detoxing, some of the substances that you produce by tissue breakdown are not very good for your body. They used to be called free oxide radicals, but now they're called reactive oxygen species. And if you want to imagine what these are like, well, they're a bit like having a 5-year-old going around your sitting room with a blowtorch. And so they're not really that great, and you want to sort of disarm them in some ways or neutralize them on their way out. And that is done by glutathione. And we make our own glutathione, but one of the pathways for getting rid of paracetamol uses up glutathione. So you've got a fever, it's there for a reason, it makes everything work faster, it makes the liver detoxify better, but now you've reduced the fever artificially, so you've interrupted that. You've also diverted the liver to having to detox the paracetamol, and you've also used up the glutathione that you need for these breakdown products that you are producing. The ibuprofen is also broken down by the liver. It also can make you retain fluid in your kidney, so it affects kidney function adversely, and it can also cause problems to your heart. So you may be thinking, oh, that's it, I will never use paracetamol again, I'll use ibuprofen. Please don't do that. I don't probably have time in this lecture to go into it, but there are many reasons for not using ibuprofen, and if you're going to use either of them, please use paracetamol. So all these things are working against the body. And so instead of coming to the empty box, you end up not getting rid of what you've got. So what happens when you have the normal course of the disease and you don't block it? Well, you get your empty box, and then without fail, you go up a developmental step. There's not many 100% in life. In fact, there's almost none. And there's really almost none in medicine. But there is a 100% that if you supportively manage your child or teenager or adult through an infectious disease with a fever, that at the end of it, they will have a developmental step increase. So a small child maybe will produce a tooth. A toddler who's banging their head on the corner of all the furniture will start walking straight. A child who's gone to school or been separated from their mum or whoever normally looks after them will have to go up an emotional step. And we see this all the time. And we've developed various myths around it. For example, when children start school or they have a new teacher, they often get coughs and colds. And in fact, we have this myth. Myth doesn't mean untrue. It just means a way that we explain to ourselves what we see happening around us. And so there's this myth that when children go to primary school in September, that they give each other all these illnesses, all these viruses. And sometimes the teachers even get them as well. Well, that's a bit like saying, well, these children never met any other children all the way through the whole of the holidays, not on the bus or in the park or in the church or the scout hall or with their relatives or when they went to stay in a crowded hotel or whatever. They only just suddenly met them in September. Well, it's not because of that at all. It's because of the people who have separation issues. So children who are particularly upset about being separated from mum or dad or granny or whoever, or the ones who really loved last year's teacher, now she's different, or he, or their little friend Johnny went to Japan. And when the teachers have the same thing happening, we say, oh, they caught it from the children. But it's not it, because in these cases, not every child gets it and not every teacher gets it. It's the ones who have the same issues, usually separation issues. So maybe the teacher really, like last year's mum, really hates this year's head, the new head, or has their own emotional issues at home. Those are the people who will get them. And this idea that you go around catching these opportunities to detox is a bit like saying when you have a dustbin that's full of rotting meat, which mean you soon get flies, funguses, bacteria, horrible smell. It's a bit like saying, oh, my dustbin caught flies. But nobody says that. People will say, well, you've got a disgusting, stinky dustbin. Why don't you empty it out? You don't only just have flies. If the lid's off, you might even get rats, dogs, and cats. Okay. And basically, those organisms are how detritus gets removed. If it weren't for dogs, cats, rats, and all these funguses and bacteria, we'd be drowning in our own detritus. They are the things that rot these things down, so we can then put them in the garden around our fruit trees as compost to help us get more food, although most of it nowadays gets thrown away. So we know, a bit like the car analogy, with dustbins, we know we get all those things because there's a load of rubbish there. And if you think of ourselves, not exactly as a dustbin, but sort of as a dustbin, once you've got all that rubbish there, they actually come along to help you. So if you've got it there, all is not lost. All these things come along to help you. But then we stop the process happening because of advice that we get from well-meaning people and health professionals who should know better. And what happens is we don't get rid of what we needed to get rid of, we get the next layer. But still, all is not lost, because the child will keep on and on trying to do this detox, okay, until some, point in the middle of the night when you don't notice, so they can get down to having these empty boxes. And in fact, in my experience, some of the people who have the most resistant fevers to paracetamol and ibuprofen, the ones that shoot up, are the ones who are desperately trying to do this. So they're trying to have more and more punchy fevers so they can get through that paracetamol and ibuprofen barrier and get down here and empty their box and go up the developmental step they need to do. And so what happens if you never get a chance to do this? Well, you end up with a full box. People who are already like that for whatever reasons, how they've been born, birth problems, malnutrition, drinking sewage. There are many people in the world who die of what we used to call childhood diseases, who still die of them, but that's because they are drinking sewage, they have inadequate food, they live in unventilated housing, they may be orphans, their parents may have HIV, they might be in a war zone, okay? Healthy children who have the wherewithal to life, this does not happen. And even with the ones who don't have the wherewithal, they're still trying to empty the box, but they don't have the wherewithal to do it. If you start off like this, you won't get all these acute fevers. But you will look like one of those not very healthy children if you're a child. And basically, this is all of us, really, because once you get to be over the age of 6, it's really difficult to empty your box unless you really decide to take yourself in hand. And it sets us up for chronic disease in later life. So this very thing that we worry so much about in children, and where it happens most, is the very sign that these children are going to, please God, live to 120, and be really healthy. And the fact that we don't get them is because we're old and decrepit. And this is why we're going to die. Okay, we're going to die because our boxes are full and we can't empty them anymore. There are some other things that we can do, but I probably don't have time in this lecture. But if you look me up on Eventbrite, I do lots of lectures, and I do this one, a longer version of it, very often, because it's the most important one. So this is chronic disease in later life. So a decreased ability, for example, to clear coronavirus. So I'm going to move on to what do you do? So this is a shortened version of a 2-hour lecture. So what do you do? Well, it's all quite really simple. In fact, it's so simple that you might say to yourself, well, why do you have to go to medical school for 5 or 6 years and do all that postgraduate training if that's all it is? And the answer is, in order to know how to manage acute illnesses in children, teenagers, adults and older people, you don't have to go to medical school for 6 years and do all that postgraduate training. In fact, sometimes, and in many cases, that actually interferes with your ability to do that. Because when you go to medical school, you learn about disease and you cut up dead bodies. And that's before you even look at the indoctrination, or I should call it indoctrination, that we have with the fact that there needs to be a pill for every ill. So what do you do when someone has an acute illness? Well, the first thing you need is fresh air. So you need to open those windows or nurse them outside. Normally between about April and October, you can put somebody outside. If it's in bright sunlight, stick them under the shade of some bush. If you're unlucky enough not to be able to access any outside, I'm sorry about that, but you can put them near an open window with a sofa there. Don't leave them in a room that you can't see what they're like. It's always best to have somebody with you. And I always think with children, they should be in your bed when they're not well, unlike the case of that poor TV presenter who had twins, and they both, when she put them to bed at 9, and when she went to check on them at 9 the next morning, they were both dead. And I just sort of thought, 12 hours, goodness. Yes, but they weren't even ill. Yeah, make sure you can keep an eye on them, not to make you paranoid, but don't have them in the East Wing. And no dairy produce. This is not to do with allergy to milk. This is because milk makes mucus. It just does. It's made of protein and iron. Mucus is. So it's all those children who eat snot is actually quite nutritious, protein and iron, although you're currently chucking it out because you're trying to get rid of things that need to be got rid of. And so milk's the worst, cheese is, yogurt's slightly less worse, and cheese is the least worst. So those are things to look at when someone has chronic mucus, but in the acute situation, you cut all of this out because it makes mucus, and also your tummy's often inflamed, and when all this stuff hits your stomach lining and curdles, it makes you more like to have vomiting and diarrhea and just feel awful. And you need lots and lots and lots of fluids. They're the most important thing. People say, oh, you know, my son won't eat, and I say, marvelous. Mind you, I say that when they're not ill as well, because basically we spend all this time trying to stuff food into children, and then we spend the rest of our lives trying to lose weight. So children are naturally, and animals are naturally self-regulating in terms of food, so long as you haven't made it into some enormous power struggle. And the less they eat, the less it costs you. So so long as you're not just leaving them there with a load of sour sticks and biscuits, and what they have to eat or available is okay, just leave them to it, because leave them to get their natural appetite back, and then they'll eat decent things when they're actually hungry, hunger being the best source. Now, you see that even bigger than the open window is rescue remedy. So if you only had one thing that you needed to have, and I must tell you, I'm very keen on vitamin C, and even keener on vitamin D, but if you only had one thing, the thing you need to have is rescue remedy. If I could, I would put it in the water supply. Rescue remedy is a batch flower remedy. It's a type of homeopathy that's slightly different from the regular remedies, and it's for getting rid of physical and emotional stress. I don't know anyone who doesn't have physical or emotional stress, and if they didn't have it before the last 2.5 years, they've certainly got it now. So everybody needs to have it. Even if you don't have arnica, you can actually drop it on the person's skin. And this is in terms of arnica, I only use homeopathic remedies by mouth. I don't put them on people's skin. But if you don't have anything, you can drop the rescue remedy on it. So yes, plenty of clear fluids, and all your fluids should have rescue remedy in it. If you are breastfeeding is the best, anytime, any place, anywhere. Any other fluid, you need to put rescue remedy in it. And the person who's nursing should also have rescue remedy in their fluids that they're drinking. I'll just bring in at this point, what an important part of a child-parent or a child or adult carer relationship this whole nursing idea is. One of the things that we try to do in modern medicine is eradicate any of these developmental milestones or abilities to detox. But actually, there's a certain part in the ebb and flow of growing up and developing, and even when we're older, where we just need to step back and actually have someone nurturing us, particularly, and looking after us and stroking our forehead and maybe wiping it with a tepid sponge and putting us next to the window and maybe putting a bunch of flowers near us so that we can see something pretty, and maybe having a bit of time off school or work so that if you're lucky enough to have someone to nurture you, and if you don't have someone to nurture you, then so you can nurture yourself. Self-nurture is very important. And trying to eradicate all the opportunities, which are not only developmental, but opportunities to be loved, really, I think is wrong. And nursing is a long valued profession, both professionally and amateurly, because that's what, in particular, women have done always. I know that it seems that women are only successful if they're at the top of a corporation, but women are successful when they do whatever they need to do in their life, but also when they do the things that are particularly allied to women. And one of those is teaching, and another one is nursing, and it's a very important part of both your childhood and your adulthood. So it's really important. So you need to get the fluids down them. And I've also put here, I have a sheet that goes with this, which I can send to Sally. I put honey, lemon, and ginger. So everybody knows about honey and lemon, but the magic ingredient is ginger. And what's magic about ginger? And basically, you either grate or chop the ginger. You don't need to peel it. And you put a big pinch in a mug with 1/4 of a lemon and a couple of teaspoons of honey, and add hot water. In children, you'd cool it down before you gave it to them. The ginger helps you reduce the fever. Okay. So you're probably thinking now, she's totally bonkers. She's just talked for 32 minutes on how important fever is. And now you're saying ginger will reduce the fever. Is she mad? Well, the answer is no. Because when ginger reduces the fever, it's because it's helping the body to empty the box in other ways. So the body doesn't have to have so much of a fever. So it's called a defervescent. Like effervescent is fizzy, and defervescent is a fever reducer, but it's not artificially lowering it, forcing it down like paracetamol and ibuprofen, and it's not interfering with the detox process of the liver. It's doing its own ancient ways of reducing the fever, which automatically makes you feel better. So when you've got lots of fluid on board, a lot of the pain comes from inflammation. It's not the root of the word, but flame is obviously hot. So you can imagine that having a lot more water would douse the pain of the flame, because inflammation is cal or dol or rubor and tumor, heat, pain, redness, and swelling. And if you've got a lot more water on board, you're going to, with Rescue Remedy in it, you're going to feel a lot better. And basically you put a pinch of salt per 500 mils of water, because if you drink lots of water, it helps flush your kidneys, but it doesn't necessarily actually get into your cells. And it needs to be dissolved in the water. So that's really important. Open the window, no dairy, plenty of clear fluids, Rescue Remedy in everything. No food unless hungry. Well, actually starving. Okay, don't go making, for a person who's not a chronic invalid, do not go making special treats or special dinners or special anything. Okay, they don't need any food at all. If they're really starving, they can have something like a bit of peeled sliced apple or a bit of toast with honey or Marmite, depending on the preferences, cut with no crust, cut them into little stamp size pieces. And you need to have rest. So really forget about the food, just encourage the fluids. And just encouraging the fluids isn't enough. You need to actually model it. You know, have your own beaker that you keep drinking. And don't just leave a beaker next to somebody and think they're going to drink it, because they won't. And rest. So rest and drinking fluids are two things that you can model. Because one of the things that adults don't do is do proper illness themselves. If when they were ill, they lay down on the sofa and sat drinking lots of fluids, children would see what you're supposed to do when you're ill, but they don't. They see adults running around doing all the normal things, and they never model what you're supposed to do. So you can do that if you're having a hard time trying to get your child to rest when they're not very well. And rest is important because basically you get energy from two sources. One is food and the other one is rest. So when you come out of the park having run a circuit and you feel full of energy, what you're actually feeling is the energy leaving. So if you're not going to eat, you need to rest. You need loose clothing so you can sweat. You need no TV, computer, or books, because listening is okay, but apart from the whole thing to do with the electromagnetic radiation and frequencies to do with these items, it's just too much for you to do. Boredom is a great thing. Boredom allows you to have a little chance to hear the still small voice coming to the surface, because a lot of us get ill because of emotional toxicity. And talking about temperature, just before I need to stop for questions, what's really important about a fever is don't use a thermometer. The way you measure a temperature is you put the back of the hand on the back of your neck. Why don't you need to know the numbers? Well, you need to know someone's hot, because once they're hot, you start doing all the things you need to do when someone's not well. Open the window, give them loads of fluid, stop feeding them, pet them, you know, let's make sure they rest. So you need to know they're hot or very hot, okay? But you don't need to know the number. Why? Because the numbers can lead you astray. So for example, you can have a child or a teenager or an adult, if they're lucky enough to have a nice hot fever lying there, you know, they're obviously got something wrong with them, but, you know, they respond to greetings, they look at you, they when they sleep healthily. Sleep's the great healer. They're sipping down lots of water. If they're children, they've got lots of nappies, wet nappies. If they're older, they've got pale urine, you know. But then you go and measure their temperature and it's something like 39.5. And I must tell you that most of these things are completely inaccurate. I mean, the fever strips are a waste of time. Under your arm doesn't give you a proper estimation. It's very hard to get people to keep things in their mouth for long enough. And the only real way of doing it is to put something in their bottom. And the NICE guidelines recommend not doing this below the age of 2. And who wants to be sticking things in people's bottoms anyway? And as for the ear ones, the digital ones, they're a total waste of time. They'll give you a different reading every 30 seconds if you do them. But we do love them because they have a decimal point. So you're managing with this person who's really, they've got something going, they're doing a detox. You look at the number, it's 39.5, 39, 38.5, even if it's accurate. And for many people who are not used to working with the body in this way, that will be the end of their coping mechanism, and they'll rush off and they'll end up on this enormous conveyor belt where they don't know how they ended up with their child, for example, being in a ward with a drip for antibiotics for 48 hours until all the results come back negative. Just because of the number. On the other hand, they have a child maybe, or a young adult, who they're really worried about because they're listless, they're not really drinking, they're not really responding to you sort of normally, they just seem to have no energy, and your gut is screaming at you that something terrible is happening. but you take the temperature and it's normal, or just a little bit high, 37.5, or maybe even low, 36.5 or something. And although your gut, which I must tell you is always correct, the gut is always correct compared to the head. Your gut's saying this is terrible. You don't do anything because you don't want to be that over anxious parent or wife or father or whatever. When you ring up the surgery, you're lucky enough to get anyone to answer it, because they haven't even got a temperature. Okay, they haven't even got a raised temperature, and that child or young adult's got meningitis and they're so ill they don't have the energy to make a fever, because you have to be healthy in order to be able to make a fever. Okay, really sick children and adults can't manage to do it. So don't use the back of your hand on the back of the neck so you know that they've got a fever, so you can start doing the routine, but don't use it to get information because it won't help you. And in the talk I do, we have some examples of exactly what happened to people who did that. But where you do need a thermometer is in the room. Have a thermometer in every room, okay? And make sure it's not more than 15 to 18 and more towards 15 when someone's not well. This is not to say you need to cool it that much in the summer, but don't artificially heat it more than that. You can have the person completely wrapped up in, you know, lots of clothes, but don't artificially make the room high, because when the temperature is high, it's not necessarily always high. It can go up and down. And in order to make it go down when it's not needed, the heat needs to be able to be radiated out. And if your temperature is not that much difference to the room temperature, the gradient is very shallow, and it's difficult to get rid of this heat you now want to get rid of. Whereas if your temperature is 38.5 and the room temperature is 15, then you just have to sort of throw off some of your covers and you can easily lower your temperature if that's what you need to do. And you don't need to eat any meat, fish, fatty food or dairy until 2 days after better. Okay, so I've come to the part of my lecture that I've been allotted to talk, and now I think it's time for questions. So I'm going to stop the share and go back to Sally.
Thanks, Jayne. Oh my God, that was so interesting. There was one thing I remember we had a conversation about, and that was about fever being a kind of a clearing mechanism in children. And quite often children who might be stuck in a developmental stage would have a really hot fever, and suddenly they would start reading or they would start talking, or something else might happen. And when I first heard this, I thought, oh yeah, okay, that's very interesting. But then I saw it for myself with my own daughter, who had a very hot temperature because she had measles, age 13 months. And when she started to recover, suddenly she added at least 10 or 15 new words to her vocabulary, and she was only 13 months.
Yes.
So why does that happen, do you think?
Well, it's a bit like a snake. A snake can't stretch its skin, but it gets to the point where it needs to grow bigger. So it eats a lot, then it lies quietly for a while, and then it has this crisis where it snaps off its old skin and it slithers out with the new shiny one, which over time will solidify. And it's a type of crisis. And that's the same type of crisis we need to do when we need to stretch ourselves and acquire new skills, whether they're emotional skills or fine motor, gross motor, speech. So we have to clear ourselves out in order to go forward, because if we're really toxic, we just don't have the ability to do that. I remember at one point with my children, they were part of my journey. So I started off thinking conventionally and then learning about holistic things as time went on. And one of my daughters, when she was 6, so she wasn't reading, she didn't go to school. Well, she went to school for 6 months and she was home educated. So we do things in different, we worry about things differently. And so she didn't read. So she was lying in bed and she had this big fever. And although I am a fully qualified doctor and I've done postgraduate pediatrics and so on and so forth, after a few days of a continual fever, even though I was giving homeopathic things, not to reduce the fever, but to support her, belladonna and aconite, for example. And I was thinking, as every evening she got this fever for about 3 or 4 or 5 days, I thought, oh, what if she's got meningitis? And then I thought, well, why would she have meningitis? I mean, what do you do to suppress anything? Meningitis is a form of invasive disease. Nobody dies or has or becomes disabled because of the normal course of an infectious disease. They do it because of complications, and the complications are all invasive. So I talked myself through that one. And then at the end of those days, she'd been looking at the bookcase of videos that were next to her bed. And as she lay there, she just learnt to read. I mean, she could have read probably if she wanted to before, but she just decided she would, sorry, she was 9. She just decided she would read, and that was it. And then she just carried on reading. After that, she just learnt all of those. And I have a story also about developmental challenges. A lot of people worry that their next door neighbour's child can say 15 words and their child can only say 3, or the other one can climb up on something at a play park and the other one can't. But people are individual, and people don't develop things globally. You might have a vocal lead in one, you might have a fine motor skills in another one. We're all a bit different. And there was this baby who was born in normal delivery, no reasons for any problems, but this baby didn't do anything. It was a boy. He did nothing. He just lay there. He fed and he peed and he pooed. And he didn't roll and he didn't sit. And he got to 6 months. He got to 3 months. He didn't turn. They decided that he must be developmentally injured and that there was a problem. And he carried on like this, just lying there being fed by breast or bottle until he was something like 11.5 months. And then he had this fever. It's the first one he'd ever had. And they were so worried with his obvious developmental delay and probable diagnosis of brain damage that that something terrible was going on. So they rushed him to hospital. He had a lumbar puncture. They didn't find anything, but they decided anyway to put him on a massive intravenous antibiotics just in case, because of his history. And the next morning he was lying there in bed and he had 10 teeth. And basically that's all he'd been doing for 11.5 months. He'd just been making teeth. And after that he sat up and he started words and he started walking and he did all these things. But all he did for that amount of time was make teeth.
I really, really recognize that, because my youngest daughter, I think we came to see you with her actually, because we were worried that she had blood in her stools and she wasn't really putting on any weight. And I recognized that she was teething, and I think she had 8 teeth come through at the same time. And it was exactly that. She was just spending all her time making teeth. And once they'd come through, and once we gave her the right remedy for sort of excessive teething, yeah, she started to thrive. The other thing I was going to ask you was, I didn't find, the reason I came to homeopathy is because I didn't find paracetamol very effective with a fever. So my eldest daughter was 8 months old. She got a temperature of 104, which is, who knows, because we don't know whether the temperature measurements are accurate, but she was hot to the touch. And I was giving her paracetamol, Calpol, and it was making no difference whatsoever. And a doctor friend of mine, who was only 26 and newly qualified, suggested I phone a homeopath. And I found the questions she asked me as interesting as anything else, like, have you started giving her anything new to eat recently? And I just started feeding her formula milk. And it appears that something in that formula milk had made her temperature go up. And whatever had made her temperature go up could not be brought down with Calpol. So what do you think might have been going on there?
Well, Calpol, which we'll call paracetamol, so it's not to upset the particular owners of that particular copyright. It doesn't. When the body fights hard enough, it can't do it, but it does nonetheless divert it towards detoxifying it and uses up the glutathione. The other thing that soaks up glutathione is vitamin C, which we don't make ourselves, along with some types of fruit bat and some guinea pigs. It's something I've come to more in the last 5 to 6 years, and it's not necessarily something that I say you need to give to somebody whenever they have a fever if they're children. I think if you're an adult, you should be taking it as a matter of course. And in terms of the whole thing to do with, say, for example, something like COVID, as I discussed in my presentation, basically people have fevers till they're about 6, and then they become really quite rare. So whether you think various interventions to stop you having things that will give you a fever are either safe or effective, you have to ask the question, as we get older and as we die because our box is full and we can't empty it anymore, why would you want to interfere with anything that might lay you in bed and give you a nice hot fever, which would give you a chance in your elderliness, i.e. being over the age of 6, give you a chance to empty your box, why would you not embrace it? I mean, if you were going to get flu in the winter, and you're 60 or 70 or 50 or something, why would you not want to have it when you know that your eliminative processes are so poor as you get older, unless you're doing a really good job at trying to make yourself, keep yourself running clear? Why would you not want to have it? Why would you not want to embrace it?
Well, quite. Somebody has asked in the chat whether you believe that terrain theory of disease is correct and the germ theory wrong, or is there room for both?
I think, well, I believe in, I think when you look at what happens, I think you don't catch germs. So I suppose that means I don't believe in the germ theory. I think these things come along because we need to have them and we work with them. And you have to really ask why these germs from outside would be so bad for us, considering we've got about 2.5 kilos of germs on the inside, without which we wouldn't be able to function. And we talk a lot about our brains deciding what we do, but there's so much evidence now that actually the gut has such an effect on our brain, and the microbes have such an effect on our gut. You have to really ask, who is the dog and who is the tail? Is it the microbes running us or not? So I think that if you have a very healthy person who doesn't need to detox, then they won't have lots of fevers, and the people who do need to have it, then they will. So obviously they'll have something that's around. They won't get something from Mars. The whole thing about viruses is a completely different thing, which I came across several years ago, and I write for the Informed Parent, and I wrote my eventual thoughts down on that a few issues ago. I do recommend that people subscribe to the Informed Parent. It's a very good publication, and I certainly think that viruses, what we call viruses, are pieces of DNA and RNA. And I do know that when we have cell breakdown, we break down the parts of the cell, and we also break down other bits in the cell, which include DNA and RNA. So when you see these things in people's bloodstream, when they've got something like measles or polio or whatever, are you saying, is that the causal agent, or is that the product of this particular type of cell breakdown? You have to ask yourself.
Yeah. Somebody else has asked, what is the best way for adults to detox?
Oh, well, so one of them is making sure that if you're lucky enough to get a fever, go to bed and feel so lousy you can't do anything. Go to bed, enjoy it, drink loads of fluids, tell everybody you can't do anything. If they offer to bring you around chicken soup or whatever your vegan alternative is, say yes and allow people to look after you. Do that, and preferably get ill, so that you get bored, so you can find out what the emotional causes of your disease are. But one of the things you need to do to make yourself run well, going back to cars, people seem to, even if they don't have any mechanical ability in terms of fixing cars, they seem to understand cars with less trepidation than actual bodies. So if you have a car and you want it to accelerate well and run well and not have clickety noises, you want to make sure you've got a clean air filter and you've got a clean oil filter and all the other filters are clear. So you're not going to have all these fevers, but as a grown-up person, you can start making sure that all your avenues for elimination, I've got a sheet on this which I can send you to send out if necessary, are being used. So one of the ways we eliminate things is through our lungs. So you need to have the window open at night. I mean, everyone should have the window open at night, because that's when you repair everything and you need moving air to do it. And you're better off going to bed with a woolly hat, 6 jumpers, 5 duvets, bed socks, and maybe somebody else or a dog to keep you warm, than having the window closed. Okay, so you need the window open at night. That's crucial. Sleep is also crucial. Sleep is another form of detox. So you need healthy sleep, which needs fresh air. And another thing that helps you detox is obviously your liver. So there are elaborate liver detoxes, but a very simple liver detox is just making sure that the first drink in the morning is warm, not cold, something warm, because it will help your bowel open, and have something bitter in it, because that will let your bile salts flow. And if you wonder how that will help your bowel, well, just think about the difference between jumping into a freezing swimming pool and sliding into a warm lagoon. You can just feel yourself relaxing, and that's what your gut feels. If your first drink of the day is freezing cold, that's what your gut does. So you need something warm and a bit bitter to get your bile flowing. The classic thing is lemon and water. But if you've got not very good enamel, you might want to find something slightly different, like some bitters, or something like a miso or something. Okay, that's slightly bitter. You need to make sure your kidneys, that's the fourth way, that the kidneys are working well. So that means drinking at least 1.5 litres of fluid a day. Ideally, all your water should have rescue remedy in it, and making sure you've got a pinch of salt per 250 or 500 mils. If you're in a very hot climate, obviously you put more salt in it. Indeed, I grew up in Bahrain in the Middle East, and we used to have a big jar of red shiny coated tablets for when you got salt cramps. I've got no idea what was in the red stuff, but it probably wasn't very good for you. But you need to have a pinch of salt per 500 mils, because just having lots of water will flush your kidneys, but it won't necessarily hydrate your cells. And the last big avenue of excretion is your skin. So when you're not wearing many clothes in the summer, the skin has a chance to breathe, and sweating does that as well. Particularly in the winter, when you need a bit of help, Epsom salt baths are what you need to use. So there's two types of Epsom salts. There's the expensive ones in a small packet for making you move your bowels, and there's the cheaper ones that come in 0.5 kilo, 1 kilo, 2, 3, 20 kilo tubs and bags, and you put a 2/3 or a cup in your bath, and you soak in it once a week. If you want to make it nicer, put in some lavender oil or something else. Of course, many people don't have baths nowadays, but you can actually go online and get yourself for about 30 or 40 pounds a collapsible tub thing, so that you can still line your bath and detox. And this Epsom salt's a magnesium sulfate. It's a good way, if you're low in magnesium, for the magnesium to be going back in, but it helps suck toxins out of your body. And you need to soak in it for 20 minutes.
And I think we were going to have a chat about, if you're pregnant or breastfeeding, obviously you want to stay away from pharmaceuticals. Is it possible to look after yourself if you get sick in any kind of natural way while you're pregnant or breastfeeding?
It's exactly the same thing. You open the window, you take loads of fluids, you don't eat unless you're starving, because you've got a whole load of steroids that will start breaking down your stores, particularly for this purpose. You won't be starving your baby. When women get fevers when they're pregnant, you always have to ask, is it something to do with the urinary tract? And certainly having recurrent urinary tract infections in pregnancy is associated with problems. It can be associated with growth retardation in the fetus, the one said to be causing the other. And I have talked to many people who have just been told, because they have a positive urine sample, that they must go on the antibiotics, and they have decided they don't want to do that, and have decided themselves to use vitamin C, and they've used liposomal vitamin C, which is quite expensive. It comes in sachets of 1 gram, and they've taken that 4 times a day along with the other measures, and they have had a successful pregnancy, a successful resolution of fever, and a successful outcome.
And I remember when I was breastfeeding, getting mastitis, and obviously you're prescribed antibiotics.
Yes.
And that, that you're told it's not dangerous for your child, but I definitely remember my child's getting diarrhea after taking antibiotics while I was breastfeeding.
And thrush, that's the other thing they get.
Well, the second time, with the second baby, I think it was a Eupatorium perf that
Yes.
I used for mastitis. So it's really useful for breastfeeding mums to know, because you feel awful when you have mastitis, but it's so easy to solve with that one remedy, Eupatorium perf. Is there any other remedies, or is that the main one?
Well, there's more than one remedy, as there often is in homeopathy, because with homeopathy it's not so much the mastitis, it's the person with the mastitis. But one of the things, leaving aside homeopathy altogether, that gets missed out in people describing how you manage these things, is just physical measures. So, for example, the measures I've described, I haven't discussed homeopathy. There is a simple way, there's a simple homeopathic sheet for managing fevers, but you can just do ordinary things without even entering those, because naturopaths, for example, don't necessarily use homeopathy, although many of them do. So one of the things is to try and unblock the ducts. And of course, that's all to do with the fact that the breast has 4 quadrants. You need to put nice hot towels on them on either side to try and reduce. You would think it would increase, but it won't. It increases the flow. And then you have to realize that, from not showing on myself, but they come in from the center to the nipple, from the top of the axilla to the nipple, from underneath to the nipple. They come in like a cross, and you have to massage your way down those avenues of all the milk tubules. And sometimes you can come to a blockage, because massaging down through all of those and up from the bottom can often stop the blockage, because most people get mastitis because they've got a little blockage somewhere. And often people are told not to breastfeed on the breast that's got the mastitis. 100% you need to breastfeed on it, because the baby is so much more efficient at getting the milk out than any type of massage or machine is, that you definitely need to keep that going. Yes, so you always need to do the physical processes as well.
Jayne, we've got 2 more questions and 1 more minute, but hopefully we'll get through.
Yes.
What about magnesium citrate? I understood that it was more easily absorbed than sulfate. I recommend magnesium flakes instead of Epsom salts. They also come in large kilo bags for not very much money.
Okay. In terms of actually topping up your magnesium, as I understand it, it's the oral absorption is not necessarily that good, so it's much better coming through your skin. And I have no opinion on whether citrate is better than sulfate. I've only ever used Epsom salts, and that's what I've learnt about. And I can't quite see how Epsom flakes should be different if they're going in the bath, unless they have a different formulation of magnesium to the salts.
Okay, and the last question, how much vitamin C and vitamin D per day do you recommend for healthy adults?
Okay, so vitamin D, most adults in the winter need about 9,000 international units, and in the summer need about 3,000. Children probably need about 1,000. But for adults, the most important thing is you need to know what your level is, because all the way through the COVID thing, I have no personal professional experience with ivermectin or anything else, because all my patients had really good mid-range vitamin D levels, not the 50 that, if you're lucky enough to get an NHS test, is said to be okay. The range with UK units, they're different to the US, is 50 to 250. And if you're 47 or 50, you're told you're okay. Just being on the other side of rickets is not health. You need to be up at 120 to 150. In US units, that's 40 to 60, because they have different units. That's where you need to be. So all my patients were up there. Some of them got what was described as COVID. Some of them were quite ill. None of them went to hospital. Heaven forbid, none of them died. Okay, so I relied on having a good vitamin D, a set of supplements to take. And for vitamin C, if you were a rat, which is a quite successful creature of an adult size, an adult human size, you'd be making 4 grams per day. So I recommend 4 grams of a slow release vitamin C per day for adults as a general measure. Ideally you take it 2 twice a day, but I can never remember to do that, so I just take 4 in one go. Not just as crystalline or non-slow release tablets, because then you'll just get a peak level. You want it to be seeping out through the day, and if you get ill you need to take more. And if you want to know how much more you need to take when you're ill, you probably need to do it by titrating up to bowel tolerance with a non-slow release version. So then you know how much you need in a whole day, and also going on to liposomal if you're really quite ill.
Yeah, I think you recommended me 10 grams at one point, and I was fine with 10 grams. I
Yes.
can't remember why I was unwell.
Yes.
But oh yeah, I probably had COVID. But
Yes.
yeah, so I did up to 10 grams a day, and that was fine.
So the vitamin D is the most important thing, and I think for children, I don't think you need to measure it. They need about 1,000 international units a day. Ideally, you get it from food. It's always best to do that, but you know, and ideally you have it as a spray, so it bypasses your gut, because you can have people who are eating eggs, butter, walking out every day with their skin exposed, having super North Atlantic fish oil and whatever, and then you find out that and then they've got symptoms which you think can't possibly be due to low vitamin D, and it turns out their level is 40 in the UK units, and it's because they're not absorbing properly. So the reason we have a very long gut, and it has these little hairs on it called villi, and little extra hairs called microvilli to increase the surface area, is also we can absorb fat. Vitamin D is a fat, And if you have anything wrong, any type of tiniest bit of inflammation, you'll reduce your area for absorbing vitamin D, including any type of gut dysbiosis or whatever. So I think get your level up to the right level. And if you can maintain it with food after that, that's fine. But I think everybody who's adult ought to have a test to see if what they're doing is what needs doing. And then after that, they can do it the best possible way they can, ideally with food. But if not, just get it there. And once you get to the right level, you need to add K2 if you're an adult, so that the calcium, because vitamin D is all about your immune system, but it's also obviously about calcium in teeth and bones, and you want it in your bones, not in your teeth, not in your arteries. So you have to add K2.
Oh, Jayne, thank you so much. I honestly, we could talk for another half hour, I'm sure, but we are out of time. So I just want to say thank you very much for joining us.
A pleasure.
And Jayne's also going to talk on day 3 when we talk about what natural interventions can help child, teen, and young adult mental health so that they don't have to be on Prozac for the rest of their lives. So we look forward to that, Jayne, and have a great afternoon.
Thank you. And thank you for inviting me. God bless.
Thank you. Bye-bye. So everybody else, the next speaker we have in 11 minutes now is Dr. Aseem Malhotra. So you have time to take a break and we'll catch up with Aseem in about 10-15 minutes. Thank you.